Hello, this is our case study presentation for the IPE case study competition. My name is Jacob Schultz.
My name is Maria Martuch Robinson.
My name is Anna Gomez.
All right, and we'll get her started. So, our patient today, his name is Mr. John Jones. He is 36, and his chief complaint is of shortness of breath and a cut on his arm. So, Mr. Jones presents today with complaints of shortness of breath and a cut on his arm. He reports he has been to the emergency department in the past for treatment of his injuries, but does not see a regular doctor. He reports he has not received any imaging recently, and the patient currently has limited living and personal cleanliness opportunities with a history of significant alcohol consumption. The patient presents with an antalgic left gait pattern and a mild shuffling gait. He also demonstrates a forward head posture with rounded shoulders and demonstrates signs of ascites. His blood pressure is mildly elevated at 138/88 upon testing this date. He demonstrates decreased lower and upper extremity strength, with the lower extremities being greater than the upper extremities, and has decreased activity tolerance. He has mild soft tissue restrictions secondary to his history of cellulitis with associated poor tissue healing, and currently demonstrates redness and irritation around his wound. Mr. Jones also demonstrates decreased skin integrity with associated signs of dehydration. Mr. Jones reports a difficult social history with a recent separation from his wife and children. He has a history of unemployment and increased alcohol consumption as well. He also demonstrates significant signs of depression as indicated by his PHQ-2 and PHQ-9. Mr. Jones does not have a significant medical history prior to his admission to the ED for his current complaints. Mr. Jones is appropriate at this time for interprofessional care to address his physical, social, and emotional impairments. All right, so going into this case, we kind of dived in a little bit and tried to come up with the pertinent things that we thought needed to be addressed and uncovered within this scenario. So go ahead, Anna. One minute, Anna, you're muted, sorry.
So while the individual did express concern for the injury on his upper extremity and shortness of breath, this interprofessional care team concluded it would be best to conduct a comprehensive medical evaluation to ensure that all areas pertaining to the patient's health were assessed. So the evaluation looked at Mr. Jones's current lifestyle, habits, physical health, mental health, and past medical and familial history. So some key findings that we uncovered in this scenario: first was his blood pressure. It was slightly elevated, which they were in pre-hypertensive ranges. His basal metabolic panel that we did, he had a very high bun to creatine ratio. Glucose levels were normal, CO2 levels were normal, calcium was normal. His sodium and chloride levels were quite low, which does suggest that he may be dehydrated. His urinalysis also came back with a high urine output, and his coloring was quite dark, which also indicates dehydration. In terms of the mental health screenings that we performed, the PHQ-2 or Patient Health Questionnaire and PHQ-9 were also administered to him. The patient scored a 5 points on a 6-point scale for the PHQ-2, and for the PHQ-9, he scored 21 on a 27-point scale. For the PHQ-2, the 5 points on a 6-point scale did indicate a high prevalence for depressive symptoms. For the PHQ-9, he also had a very high score, which did indicate very high level of depression or severe level of depression. So further evaluation by a licensed psychologist is recommended. A substance use screening would also be recommended because the patient did express frequent use of alcohol.
So as a group, when we were deciding on what professionals to be included for this case, the current and previous health concerns were assessed. This creates a picture of the patient beyond singular health. There are multiple parts of John's situation that had influence on other aspects as well. The homelessness and possible poor hygiene could contribute to respiratory problems and other infections. The mental health status and substance use could be a contributing factor to job security and ability to support himself and his family. In order to provide the best outlet for John, there are multiple professions needed in this case, including physician, nurse, psychologist, social worker, public health worker, physical therapist, athletic trainer, and health administrator.
All right, so when we're looking at an interprofessional care team and how it's going to best serve this patient, we decided that this individual would best be served by a care team that would be able to address his physical needs, psychosocial needs, and community health needs. So we kind of broke it down into each little section. So specifically for some of the physical needs, this individual would benefit from wound management to address his cellulitis and provide education and resources to prevent a recurrence of cellulitis, and also just to address some of the associated deficits from kind of being low activity tolerance, and the cellulitis can also impact strength and everything else. So we thought this team would include a PA, a nurse, or like a PT for wound management. Kind of include the PT in there, gonna be honest, because gotta represent, but likely definitely a PA and nurse. And then it would likely also include an athletic trainer for an appropriate health plan for prevention of injury in the future, and also to address some of those deficits that we found, just in terms of activity tolerance, strength. So he would also benefit from a psychologist to help him address his substance misuse disorder and his feelings about losing his job and his family. This team might also include a social worker to open up safe communication with his family and provide him the appropriate resources and groups to prevent relapses and continue moving him in a direction where he has the tools to get back on his feet. And then that might also include like a health administrator or public health worker. But then the final little bit, he would definitely benefit from a public health worker so that they could help him identify risk factors for him, come up with the appropriate plan on where to get him resources to address these risks, and maybe help him find job opportunities to open up more avenues. So that team would probably also include a social worker, because the social worker could work in time with him, and they could figure out the best route to go. So then the interprofessional team would be most beneficial to this patient, as he requires assistance in multiple areas of his health, as we already kind of talked about. So through having a team approach, he's provided expertise from multiple individuals to address each factor of his health, which is like the biopsychosocial model, and thus provide him an opportunity to recover from his past difficulties. Ultimately, his situation is one in which addressing just one factor, such as his cellulitis, would not change the big picture, which is why the interprofessional team approach is the best for him. In order to truly make a difference for this person, we must address the root of the problem, and for him, that is a multifactorial issue.
So if we fast forward 1 year later, hoping for the best, we will be able to see many improvements in John's health. Assisting with the mental health issues is one of the primary factors to change John's outlook on his situation. While working with a psychologist and social worker, there are avenues that John can take to get a steady job, consistent living situation, ideally reconnect with his family. Removing John from the street would help with overall daily hygiene, which could relieve some of the constant skin infections and wounds. Throughout the year time frame, there were breathing issues that needed to be addressed, such as asthma, emphysema, or anything alike. The appropriate medication or treatment could be provided to have that issue under control. The interprofessional health team is an imperative part in order to holistically help John. The communication and cooperation between the physician, psychologist, and social worker or public health worker creates a network to provide health information and health care, giving John the opportunity to have multiple options in his life. And real quick, if we wanted to take a look back at our primary learning objectives and the IPE core competencies, we can go through and discuss each of those.
So the first on our list was values and ethics. So while evaluating Mr. Jones, it definitely became clear to our team that there are multiple factors affecting his overall health. We cannot simply address the patient's current health issues because they stem from a multitude of underlying factors, such as his homelessness, financial troubles, inadequate nutrition, substance and alcohol abuse, behavioral health issues, and lack of insurance. As we investigate the case further, we need to ensure that we are making decisions that address these underlying issues. And among ourselves, it's important that we maintain a climate of mutual respect, integrity, and trust. The nature of this case is very complex, so as we discuss possible interventions, we need to ensure that our decisions are tailored to meeting our patient's ultimate goal, which is to provide him with the highest quality patient-centered care and improve his quality of life.
When talking about roles and responsibilities, while assessing the case, our group determined that there are multiple aspects of healthcare which could contribute to John's current state. There's a more immediate aspect being wound care, possibility of infection, breathing troubles, but there's also larger issues such as homelessness, mental health, substance use, and many others which need to be overseen by a long-term team. This creates the necessity for a team overall, from the leader to the ground level individual, and the roles and responsibilities need to be defined between healthcare providers.
And then regarding interprofessional communication, so our group addressed this topic as it seemed especially pertinent to this case. Mr. Jones is an individual who has returned time and again to the ER without being screened for homelessness, which is something that we believe can commonly happen if the entire interprofessional team isn't working together. So by utilizing interprofessional communication and opening up the doors for communication with Mr. Jones as well, we can more easily find long-term solutions and provide preventative care so he can progress rather than regress or stay kind of stagnant like we're kind of at right now. Furthermore, interprofessional communication will be key in this case as we have identified several areas: physical, mental, and emotional health, respiratory health, public health, and social situation management that we are concerned about and would want to recruit professionals of those fields to assist with screening and providing a well-rounded course of care. So then just the last little bit is the teams and teamwork. Those kind of go hand in hand, the communication and the teamwork. Our group addressed this topic as we believe it coincides strongly with the communication. So specifically, we believe that our interprofessional communication will be stronger and more effective if our ability to work as a team with Mr. Jones and other professionals is just as strong. Thus, we believe it is important to make the appropriate referrals, openly communicate, make a plan with those professionals and Mr. Jones, and then appropriately direct and accept direction for execution of that plan. In order to effectively execute that plan, we believe it is important to allow for interdependent leadership and mentorship among professionals to ensure we are addressing Mr. Jones' financial needs, physical needs, psychosocial needs, and public health needs. To allow for appropriate leadership and mentorship, we also believe it is important to understand each other's roles and respect the knowledge each professional brings to the team. So that is the majority of our case. It was definitely a very interesting one to work on together, and it's something that I think all gave us a little bit of insight into just how much it takes to help one person.